Okay, I think we can begin. Ladies and gentlemen, dear friends, I welcome you all to today's webinar, which is a presentation of an interesting case of mastitis and galactocele by Dr. Atul Jaggi. Let me first say that this session is being recorded and will be uploaded in the YouTube for free access as well. During the session, you can write your questions in the chat field, and we will try to answer them after the presentation. After the Q&As, Andreas Sokanas from the VC team will close the session and will tell you about an offer that we have. Now, some words about our speaker, Dr. Atul Jaggi. Dr. Atul Jaggi is an excellent homeopathic practitioner, having a busy practice in Nashik in the state of Maharashtra, India, not far from Mumbai. The name of his clinic is H3, Center of Classical Homeopathy, with A3 meaning health, happiness, and homeopathy. He's an international teacher of the International Academy of Classical Homeopathy and an assistant to Professor George Vithoulkas. He has studied by his side for many, many years. He is also one of the International Academy of Classical Homeopathy e-learning course coordinators. This e-learning course by Professor George Vithoulkas is an academic online program based on the highest educational standards of Hahnemannian homeopathy. Dr. Atul Jaggi is an expert user of Vithoulkas Compass program as well, knowing its various features and how the program can help the practitioner reach the correct remedy. Dear Atul, the stage is yours.
Thank you, Dr. Lefteri, for the kind introduction. As you so correctly said about H3R Center, Health, Happiness, and Homeopathy.
Very good.
The credit of this name again goes to Professor Vithoulkas, because one of his statements motivated us so much that the goal of the medicine is to give happiness to people.
Exactly.
So, what is medicine without happiness? That is why, and we can, I think homeopathy is a divine science that gives happiness and health, both.
Yes, of course.
Also, I must say here that we have been very fortunate to be students of Professor Vithoulkas. And I would have been lost without him in our lives and without Vithoulkas Compass in my practice. So thanks to VC team and thanks to Professor Vithoulkas. Okay, so without any delay, let me share my screen so that we can start with the case. Okay, so all friends, this is a case of a female, 35 years old, and she was diagnosed with mastitis and galactocele. The first consultation was on 25th December 2021. Now, if you look at your screen, she went to the gynecologist on the same day before coming to us. This is a women's hospital, a gynecologist, prescriptioner. So it says that on examination, there is a large lump in the right breast, which in question mark, the gynecologist writes, probably it's a galactocele. And she advises a sonomammogram for the patient. And together with this, she prescribes an antibiotic 3 times a day, a probiotic, a painkiller, and another painkiller 3 times a day, as you can see on the screen. So she goes for the sonomammography of both breasts, and it's written here that the patient complains of a tender, lumpy feel in right breast, and she is lactating. So the sonomammography report says, as you can see on the screen, the site of tender, lumpy feel in right breast lateral quadrant shows dense, congested breast glandular parenchyma with dilated ducts within and mild breast glandular edema in the same location. So I will read it carefully again, that there is dense, congested breast glandular parenchyma and the ducts have dilated within with edema. And not only this, there is reactive axillary lymphadenopathy also on the same side, right side. So she has been prescribed antibiotics, which she did not wanted to take, and she came the same day to us for homeopathy. So we took her case. The presenting complaints pain on lateral side of right breast, underlined 3 times. It was severe pain for last 2 days. She has been lactating her son for the last 2 months. Okay, so she gave delivery 2 months ago, and for the last 2 days she has this pain. Now the characteristic of the pain was that it was severe pain and it would appear suddenly and disappear suddenly. Okay, and the painful area, she would feel a small lump and it was hot to touch. So there is an inflammation together with a lump and it is hot to touch. So I would like the participants to share, because these were the acute symptoms that I could gather, how they would like to proceed. This was the information regarding the mastitis.
Belladonna is a remedy written by almost everyone.
Correct. Even I was thinking about belladonna because the pain appears suddenly. That is correct. So let me go to the compass and let us study the case together.
Vithoulkas, magnesia phosphorica, and other 2 suggestions.
Absolutely. So let us study the first rubric, pain, right mammary. So it says pain, aching. Now this is the rubric, the 4th one, chest, pain, mammary, right side. Now this is why we should, this is underlined 3 times in the patient. And here we find an interesting remedy, Philandrium, Ignatia, Carboanimalis, Cotyledon, and Radium bromatum, sanguinaria, and Zincum. So if we are not aware of the remedies, because for right side and pain sudden, of course we think about belladonna. This is what I also thought. But the repertory says that you should also think about philandrium. So what we do, Compass gives us a very good possibility of referring the materia medica immediately. If we click the remedy, we open the materia medica and let us read it together. It says the respiratory symptoms are most important. Then under chest, it writes sticking pain in the right breast near the sternum, extending to the back. So for philandrium, we have to have this pain extending to the back. So what we can do, I immediately put this question to the patient that do you have this pain in the breast which extends backwards? And she said no. So it was a negative answer. So let us go back to the rubric again. Okay, now there is one more thing that we must always do because we referred philandrium. So what we can do, let us search symptoms of mammae, which we write in the search area, and we write philandrium, and let us see how philandrium is represented in the repertory for the word mammae. Now, this is a very good possibility that Compass gives us so that we can immediately know about the keynotes of a remedy. So once I search, you can see in your screen, it says pain right mammae, extending to back. As we saw, this is quite strong. During menses, but this, she is lactating, so we cannot ask this. Extending to back is, as I said before. But another interesting keynote is this one, which is not mentioned in the materia in the book. Pain mammae, lactiferous tubes when the child nurses. So the search in the Compass gives us this possibility that we can put this question that when the child is nursing, does she have the pain? And unfortunately, she said no. So by this way, just a minute, we could not confirm philandrium. So next possibility is another, it says, we all are aware of carbo animalis, that it affects the glands, it affects the breast, but we should have some symptoms like homesickness, nostalgia, grief, but this was, I will come to this. So this is one possibility. Next, the repertory also suggests cotyledon. Now we should also click this and read it because under chest it says pain under the left nipple and aching in the right breast. Is this the remedy? But it says marked action on the heart. Well-marked pains through the breast to the scapula. But this was missing in this case. So slowly we should refer to the repertory and get some suggestions. So this was the first rubric I inserted. Then the second rubric was inflammation mammae. Let us see. It suggests 45 remedies here. And as you can see, belladonna is quite strong. And as some of you suggested Vithoulkas, which again is a very good remedy for breast affections. Now, if we don't know Vithoulkas and we know only belladonna, what we can do as Compass users, this is very interesting. Again, we write mammae here, and for remedies, we write belladonna first, and then we write Vithoulkas. And we can search in the repertory that how belladonna and Vithoulkas are represented for the word mame. So if we look at this tab, which is common, it will show us the rubrics where both of these remedies are present. As we saw, inflammation, mame, the first one. But we are interested in specific rubrics. So let us click on this tab, exclude. And here the compass tells us what is specific for belladonna and not Vithoulkas. So let us see. Pain, sore, bruised mame going up and down the stairs, or jar aggravates. So this is specific for belladonna and not Vithoulkas. So by doing this, we can differentiate right there and then the remedies. Are we going towards Vithoulkas or belladonna? So now this shows for belladonna, but if I double click Vithoulkas here, the specific symptoms of Vithoulkas will appear. So look at the first symptom. Pain mame, left side, extending to whole body. So we can immediately ask the patient, does she have this modality that the pain is extending? She said no. So what I'm trying to say, my friends, we can use compass for every rubric and get the differential, which will help us put questions to the patient. So by looking at these two rubrics, we get some ideas. Let us insert the third rubric now, which was pain appearing suddenly and disappearing suddenly. So we have 26 remedies here. Belladonna, Calibichromicum, nitric acid have this symptom. But see, we also find Vithoulkas here. So interesting. Vithoulkas, a remedy for breast affections and pain appearing suddenly and disappearing suddenly. So it is, you see, there is one option, we put all the symptoms and we just look at the results. But we miss the learning there. The learning is when we look into every rubric, compare the remedies, and then we learn with each case. And Compass gives us this possibility at every step. Now let me put the fourth symptom, which was swelling, mame, hot to touch. So it says swelling, mame, hot, where we again find belladonna, bryonia, calcarea carbonica, mercurius, which is also a good remedy for inflammation if the pains are worse in the night, and phosphorus. Okay, so let me go back to my slide again. So when I tried to confirm about belladonna, she told me that the pain is not affected by jar or touch, and the extremities were also not cold. So unfortunately, my friends, belladonna could not be confirmed. Similarly, as I told you before, keynotes of philandrium and Vithoulkas could also not be confirmed. So now, how do we proceed? Somebody says Merck, but I could also not confirm Merck. As I said, there was no salivation, no pain in the night. How do we proceed now? Any suggestions? Mental symptoms. Elicit, yes, that's correct. So let me share the theory which Professor Vithoulkas makes us understand. So here the theory is strategies of prescribing in an acute situation, as this is an acute in front of us, and the patient comes for the first time in this. So this is her first visit, her first consultation in an acute situation. Now, first let us understand the theory, and then we will together try to find the remedy. So what the theory says, that let us consider this case, a hypothetical case, where the patient needs sulfur, then calcarea carbonica, and then lycopodium. Let us say these layers are there hypothetically, and this patient undergoes a stress, an acute situation, which can be an infection, any infection, mastitis, urinary tract infection, pneumonia, influenza, or an acute injury, mechanical injury or emotional injury, fright, grief. So what are the possibilities? What are the strategies? One thing that is possible, that the patient will be able to handle the stress himself, and the defense mechanism cures itself. So they will not need any remedy. This is theoretically a possibility. So they will cry for some days after the grief and they are out of it. Or they will raise 102 fever for a day and next day they are absolutely fine. So no remedy needed. What is another possibility? That there is an acute stress and they bring a layer of an acute remedy, or 1 or 2, 3 acute remedies. So for influenza, we may need some bryonia or gelsemium. For fright, we may need aconite, or for grief, ignatia, something like this. So this is one possibility. And the third possibility is that the stress, in this stress, the patient needs the same chronic remedy in which they were before the stress. Okay, so how we would reach to this conclusion is by the symptoms that are presented. If this patient with mastitis would have shown us clear aggravation jar and aggravation touch with cold extremities, we would have said that she developed a layer of belladonna. But unfortunately, she did not. So now, as the symptoms do not point to an acute layer, it is the time that we have to go deep into this case now and find the chronic symptoms. So let me show you the chronic symptoms one by one. There was a strong grief of her father who died 2 years ago. And there was an aversion to consolation. Now, interestingly, do you remember that ignatia was also mentioned in the rubric pain, right, mammon? So does she need ignatia? Because grief and aversion, consolation. The next chronic symptom was, I found lot of anxiety in her. She is a working woman and now she had taken a leave because of after delivery, but she was working from home and she was overwhelmed and anxious about everything, underlined 3 times. great anxiety about work, about future, how would she manage her work and child together, and great anxiety about the health of her child. So all these anxieties were strongly mentioned. The next strong symptom was fear of dogs, underlined 3 times, and cats, 1. She was tired, underlined 2 times, and she would also mention a complaint, a chronic complaint, that she has pain in the legs, worse, hanging them down. So she would prefer to put them on the bed or over something rather than hanging them down. Another chronic symptom which she had was faintness on seeing blood, underlined 2 times. Desire sweets, underlined 2 times. Lemonade, once. Thermally, she was neutral, neither too hot nor too chilly, but her feet would get cold in bed, underline 3 times. So now let me put the whole case in a structure so that we can all study it together. This is the physical pathology in the first column, in the third column rather. This is the physical generals we have in this case, and the mental symptoms, and a strong grief. Now, I would need suggestions from you. Which remedy would you like to prescribe? Somebody says Calcarea carbonica. That is a possibility. Bryonia. Bryonia. I would like to see bryonia for anxiety of future because of poverty, money.
We have arnica, ignatia, pulsatilla.
Ignatia, as I said, is a possibility because of grief and pain, right breast. Carcinosin, I see, yes, because of strong fear of dogs. Okay.
Pulsatilla is another suggestion.
Pulsatilla, yes. But
phosphorus.
Consolation aggravates her. Generally, consolation ameliorates pulsatilla. So let us go to the compass and take its help. So I go to my cases and I open the case. So now, friends, what you see on your screen, what I did, I divided the symptoms to study them. So in the first analysis, you would only see acute symptoms. In the second analysis, I put chronic symptoms. And in the third analysis, I put both acute and chronic symptoms together. So let us study. I took these 4 symptoms: pain, mammæ, right side; inflammation, mammæ, appear suddenly and disappear suddenly; and swelling breast, hot. And let us solve the case with these 4 symptoms. So Compass says that the result is clear, but you have added too few symptoms, and it suggests philandrium. And as I said, I could not confirm philandrium, but I want to share for some of my friends who do not know this possibility, that what we can do in Compass, we can go to this tab, specific remedy analysis, choose philandrium here because it is giving it as the first suggestion, and we say proceed. So what it does on the left column, left side, it gives us the main symptoms of philandrium. So we are aware, we saw these pain symptoms, pain mammoth symptoms. But what is interesting, anxiety about health also has philandrium in 3. So we get to know the mental, emotional and general symptoms of philandrium by this specific remedy analysis. Expectoration, odor, offensive, again philandrium 3. So when we do this specific remedy analysis, either we can do it generally or we can choose the chapter here, wherever we want to do for any specific chapter. So the compass will give us strong keynotes on that chapter. Okay. So since I could not confirm philandrium, also before I go to the chronic symptoms, I want to share one very interesting advantage of compass. You see, here we have case notes where we can write, as you can see, but compass provides us with a template. Now, which is very interesting, that if you choose the general VC template, something like this, it shows you the format where we can just ask the patient and type it in, whatever the patient says. Foods that aggravate, if it is milk, we can type here. Desires, we can type the desires, and let's say desire milk. So we write milk and underline it 3 times. It comes underline 3. So by using this template, we can put questions and make our notes. So this is a very good possibility which we have through, let me just delete it here. Okay. So now let me take you to the chronic symptoms. So the chronic symptoms were, as you can see on the notes, grief. And on the left side are the 12 chronic symptoms. Now, before I show you the solve, I want to, you see, for me, it is very important to learn. Now, what compass, the possibility that we have from the compass is, if we go into the options and sort by degree, this is very important. Why? I will tell you before I do that. You see, for every case, we have to do an evaluation. So what is an evaluation? Evaluation means that 3+ symptoms are more important than 2+, and which are more important than 1+. Correct? This is common sense. And the second evaluation is that mental symptoms are more important than physical generals, and which are more important than particulars. So now in compass, if the symptoms were arranged in any order, but I want to sort them by degree. So once I sort them by degree, all the 3+ symptoms are arranged first. Now this is very important, friends, because 3+ symptoms show me the uppermost layer. So what I do, I arrange them in 3+, and then I look at all the remedies which are going through these 3+ symptoms. So I open up all the rubrics and I see grief ailments. I see aurum, causticum, ignatia, lachesis. I see anxiety about children, calcarea. Interesting, causticum is here, phosphorus. Then I open fear of dogs, and I interestingly again see causticum here. So is it possible, because causticum covers 3 of her 3+ symptoms, You see, this evaluation is very important to study the 3+ symptoms in the case. And also, I open the fourth one. So we see also Calcarea carbonica running all through the 4 rubrics. In grief, it is just in 1+. Right? So this sorting is very important. And another sorting, which I many times refer, is by chapter, so that all the mental symptoms are shown to me. If a case is purely mental, I can look at the mental rubrics. So this sorting is very important. Okay. So now let me go to the solve. And the compass says, also if you can see on the screen, I merge few rubrics. Mind cannot look at blood is, as you can see, Nux moschata and Illumina. And generalities, faintness at sight of blood. So if you see here, we don't see Calcarea carbonica. We don't see phosphorus, platina, sorry. So sometimes it is good to merge so that we don't miss on a remedy. Similarly, hanging down, I merged these 2 rubrics. This is a good option provided by the compass. So let us study the remedies. Calcarea carbonica covers 11 out of 12 chronic symptoms. So as some of you suggested, tuberculinum covers only 4. Phosphorus covers 7, and it has strong anxiety about children, anxiety about future. Natrum mure, because of the grief, covers 7 symptoms. So also, my friends, I want to tell you that whenever you find, let's say, 2 remedies, in this case like natrum mure and phosphorus, coming together, always think about the combination remedy also. Is it possible that this case is a natrum phosphoricum case? Many times you will reach to the combination remedy by this strategy, because both of them are pointing strongly. Think about this combination. And then what I do, I go to this add symptom. I write MAME here, and I write natrum phosphoricum to see where in the repertory natrum phos is mentioned for MAME. And the computer says chest pain MAME region of when hawking. And look at this keynote, natrum phosphoricum. So this is also very helpful. Simultaneously, you get to know about keynotes and not to miss upon a combination remedy. But unfortunately, this was not a case of natrum phos. So let me go to the third analysis, which is chronic and acute symptoms combined. So what we do here, we combined all these symptoms. As you can see on the screen now, I've added the last 4 symptoms, and the result is still Calcarea carbonica. And why? Let me show you. It covers 13 out of 16 symptoms, and the best part is, if you look at the rubric chest inflammation MAME, Calcarea carbonica is in 3+. So interesting. And if you look at swelling hot MAME, Calcarea carb is in 2+. So, my friends, you see, our thought goes to belladonna because of hot. But the repertory says that this symptom can be also found in Calcarea carbonica. So by this study, we see that Calcarea carb not only covered her symptoms before this infection, but it also covers the symptoms of this acute infection. Okay. So based on this, let me go back to my screen, my PowerPoint, just a minute. So this was I decided to give Calcarea carbonica 1 ml, 1 dose on 25th December 21. Okay. Now, 1 day after Calcarea carb, what do we expect, my friends? What is going to happen? Fever, that's a possibility to take care of the infection. Aggravation of symptoms. She is already in so much pain. Emotions, weeping. Yes. Amelioration of inflammation. Yes. You see, she is in so much pain and she is lactating. So the first symptom that we should see, the swelling may not diminish, my friend, but the pain should get better. So the pain reduced by 50%. And she said, I feel calm. So of course, this is an indication to wait. Now, because I'm always interested to see the changes in reports, because the patient may say she is better and slowly the inflammation will go away. But what about the reports? We have to prove to the world that homeopathy does miracles. So what we did, 5 days after Calcarea carb 1 ml, we send her to the same gynecologist, same place. And of course, the doctor thought that she is on antibiotics, which she was not taking, of course. So as you see here, she writes, this is a follow-up scan for congested, painful right breast and on antibiotic treatment, which she was, of course, not taking. But let us see in 5 days, a single dose of Calcarea carb, what did it do? Impression. So the gynecologist writes, as compared to the last scan of 25th December, there is no obvious glandular congestion or edema. So both these anatomical changes, the congestion and edema that were present, have disappeared. Also, there was ductal dilatation, which is not seen now. No significant ductal dilatation noted. And the most beautiful, no evidence of right axillary lymphadenopathy. So everything which was due to the infection has gone away. But this is not only what homeopathy will do in this case. We have given her a chronic remedy, and as physicians, as I said, the most important statement of Professor Vithoulkas, the purpose of medicine is to give happiness to people, to patients. So this remedy should go deep and help her. So 1 month after Calcarea carbonica, she says, in few days, the pain of mastitis completely disappeared. Energy and anxieties are all better. And when I went deeper, the keynotes of Calcarea carbonica were still present. So, of course, we have to wait and go further. 5.5 months after Calcarea carb, this was the last follow-up. There was no return of the mastitis. This predisposition was taken care of. Now, this is what we wanted to see with the remedy. Her anxieties were much better. She says there is a huge difference in my getting overwhelmed over different issues. You see, we all know about Calcarea carb, that it is a remedy that easily gets overwhelmed. It is full of worries, thinking about everything. That is why it's given in 3+ in the rubric anxiety about future. Full of worries all the time. Anxiety about money, anxiety about health of people, anxiety about herself. What is interesting, the fear of dogs also reduced. Grief of father is much less. Now, this is very interesting. You see, we have not given a remedy of grief, but the grief of father is also much less. And she says, I am over it now. Energy is better by more than 50%. Now I don't feel weakness. Now, as we go into the keynotes, the 2 keynotes of Calcarea carb got reduced. Desired sweets and the cold feet in bed. They were no longer there. The faintness on seeing blood, she could not check it in this time. No new keynotes of any remedy. So the prescription, because there was no new remedy and she was doing very well, the prescription was, of course, wait. But I forgot to tell you here, the gynecologist had told her that if antibiotics do not help, maybe we would have to do some surgery to relieve the pain. So this is how homeopathy helped her. Now, important observation or important takeaways in this case. Every case is a learning. So this case clearly elucidates that sometimes in an acute state, we have to probe deep and prescribe the chronic remedy. This we all saw here. Now, this remedy will not only cure the acute symptoms, but will also ameliorate the chronic symptoms, of course, as we saw in this case. Now, what was interesting and a learning for me in this, that another interesting phenomena that Calcarea carb helped in the grief too. Now, I will not stop here. Why? You see, you have to go into Compass and see. Now, what I will do, I will go into Compass and I will see how Calcarea carb is represented in grief in the repertory. So if you see here, grief and Calcarea carb, and I do the search. So Calcarea carb is mentioned in these 6 rubrics in the combination with grief. So if we look at head, heat, vertex after grief, there are only 3 remedies and Calcarea carb is one of them in italics. Now, I'm interested to see the authors of these remedies. So here, if we click this I, it says show rubric authors. All these editions are by Kent. So K stands for Kent, where if you go into the author's key, K stands for James Tyler Kent. You can look at the author's key here. So this is very interesting. Then the similar rubric, head, pain, burning, vertex, after grief. We see calcarea, carb and phosphoric acid. Again, let me show you the authors. Again by Kent. So why this reconfirms, and we can keep in our mind that we can raise possibly the rubric, and we can raise calcarea, carb in the rubric, ailments from grief. So if we go into the mind, grief, and look at the rubric authors, here we see calcarea, carb is again from Kent. But if we go into the rubric ailments from grief, now this is interesting what I want to show you. Rubric authors. Here, calcarea, carb is an addition by Professor Vithoulkas. It was not given by Kent. So this is Professor Vithoulkas additions to Kent repertory. GVIN. We go into author's key and we see George Vithoulkas additions to Kent repertory. So by looking at this rubrics, distension after grief, only remedy calcarea, carb by GV. Abdomen distension after grief, 2 remedies. One is by Vithoulkas, George Vithoulkas, and VCHT stands for Vithoulkas Compass Homeopathic Team. So you see, friends, it is so important that we increase our learning and we come to understand that in repertory, calcarea carbonica has been mentioned as a remedy for grief, which this case confirmed. Right? So we can slowly learn and increase our knowledge by this. Okay. So now let me go back to the another important observation was, now I want to share that, let's say in such situations where in an acute state you have to give a chronic remedy, you have to remember that in such a situation, the action of this remedy might exhaust soon, and which is in proportionate to the intensity of the acute. So this is understandable, because let's say in a chronic state, if you give 1 mg, it may last for any time between 8 months to 1 year if there are no antidotes. But if we give it in a acute, where there is acute inflammation, the chronic remedy, the action will be taken by this acute inflammation. So the effect may get over soon, maybe in 5 months, 6 months, and we might have to repeat, provided the keynotes still exist. So these were the important observations in this case. Now, before I end my presentation, I want to share the complete theory about how I started, that how is the strategy of prescribing in acute situation. So the first part was that patient came to us in the first time during the acute. That was his first consultation. Now, what happens? Now, this is the second part. What happens that if we are treating this patient and he gets the acute during our chronic treatment. So we have been treating him for months or years, and then he develops an acute. And what are the strategies we have to keep in our mind? So this is how it will look like. For example, we have already given sulfur and Calcarea carbonica to this patient. He is somewhere here in between Calcarea carb and Lycopodium, and now he develops an acute or an infection or an injury. So the first option is that, of course, the body may treat itself, does not need a remedy. The second possibility is, again, as I said, new acute remedy or remedies, acute remedies. Now,
Atul, you are not audible. There must be a problem with the connection. Let us wait.
I will repeat my last statement. So if this patient still had keynotes of the last chronic remedy and we cannot see an acute remedy, we are justified to prescribe Calcarea carbonica again in this acute, because it has helped chronically the patient. And trust me, it will help the patient. Many times we have treated 104 fever or pneumonia by prescribing the old chronic remedy, which had helped the patient. And the fourth option is, if the keynotes of Calcarea carb are no longer there, then as we did in this case, we have to take the chronic case again and find the underlying remedy during the acute, as if the patient has come to us for the first time. And probably we will have to prescribe Lycopodium, the underneath remedy, underlying remedy, which will cure the acute. So I wanted to share here that how the knowledge of theory, it's not only materia medica, it's not only repertory, it is most important, the theory also, that many times helps us to find the remedy, the correct remedy, and to evaluate the effect of our remedy. And this is why I say that Professor Vithoulkas is a life-changing teacher, because he is the only one who emphasizes so much on theory. And so many places he has filled the gaps in the theory by giving us the theory of levels of health, the theory of continuum, without which we would have been lost actually. So I am very grateful to my teacher, Professor Vithoulkas, and I am also very thankful to Professor Vithoulkas for giving us Vithoulkas Compass, and I'm very thankful to the Compass team and Dr. Lefteri and Andreas for giving us this possibility. I will stop share now, where we can solve our cases, difficult ones also, through Compass and reach to the correct remedy. So I am here for question and answers. You can go ahead and put your questions now.
Thank you very much, Atul, for this excellent presentation, this very educational presentation that show us how we can evaluate the symptoms, not only the acute, but also the chronic, very educational case. And of course, we thank you, and we thank all the time our professor, our teacher, Professor George Vithoulkas, for making this experience possible.
Absolutely, absolutely. Thank you so much.
I think you have answered almost all the questions in the process, but a question was, if I remember well now, they are rolling all the comments about the excellent presentation. A question was about the potency. Why did you choose the 200C?
No, I did not choose 200C. I said 1M.
Yes, I think the question was, why didn't you choose 200C?
Because the pain was severe and the remedy was clear.
Okay.
That is why.
Okay. And another question was, what would happen if you had prescribed belladonna in the beginning?
Yeah.
And also a differential diagnosis between belladonna and calcarea carbonica.
Right. Now, this is a good question. In my understanding, if I would have prescribed belladonna, either it would have had no effect because the pain was severe, or it might have had a similar effect where the pain would have reduced 10%, 20% for some time, and it would have come back. Now, what makes me say that? I say this because the keynotes of belladonna were missing. If it is an inflammation of belladonna, I must see aggravation jar. I must see aggravation touch. I must see immense redness of the local part together with cold extremities. Now, these were missing. And this is why I had doubts. And this is why I went deeper into the case. And the whole study showed me that calcarea carbonica even covered 2 acute symptoms. So this is why I was confident about calcarea carbonica.
Very good. And another question by Zahid. He asks, couldn't we take perspiration in consideration? Perspiration, the symptom.
Perspiration?
Was there, the patient had perspiration as a symptom?
No.
No. I think, okay. Let me see another question. How close is belladonna compared with to calcarea? I think you have answered already this. Okay, let us go up to see. Okay, another question about the symptom, about the hanging of the limb.
Yes.
What happened with this symptom?
I don't remember correctly. I think that also reduced with calcarea carbonica. Yes.
Very good. Okay.
Remedies for hanging limbs aggravate. If we look into the repertory, calcarea carb, and if I remember correctly, vipera are strong remedies for this.
And also conium, if I remember well.
Conium is better hanging the legs.
This is the opposite, huh?
This is the opposite.
The
yes.
opposite. Okay. Yeah. Okay. Some words about the potency and the repetition for the exacerbation of chronic symptoms, of chronic cases.
Yeah, this case needed no repetition. But as I said, if the acute would have exhausted the 1M and she would have relapsed again into, not even if acute mastitis, even if her anxieties would have come back, that would have been, and the keynotes, the hanging feet aggravation, or the desired sweets increasing, or the cold feet in bed coming back, I would have prescribed again 1M.
1M. So not higher potency as one asks, the same potency.
I would repeat the same potency again, and next time I would go to higher.
Okay, excellent. Very good. I think that's all.
Yeah.
Thank you very much for this excellent presentation.
Thank
We
you.
enjoy it very much.
Thank you, Lefteri, and I want to thank all of you. Thank you so much. Thank you.
Thank you.
Now, Andreas will tell us about an offer of Vithoulkas Compass and close the presentation.
Hello, everyone from me as well. Also, I would like to thank Dr. Atul for this spectacular presentation. It was excellent. And as I got the feeling that everyone was enjoyed this presentation. What I would like to share with you is I would like to share an offer that we have for all the participants. We have an offer for all the plans for 12 and 6 months who participated to use this coupon code, the VCAJ23, and they will get a special discount of 20% for any plans they choose from our website or through the program, the vc.vithoulkascompass.com. And they will get either for 6 months or for 12 months. Also, let me mention that for any assistance you may need using the program or any questions you may have or any difficulties you may go through, or even if you need to learn all the features, and we can arrange a Skype or a Zoom call so we can go through the program and we can explain and answer any questions you may have, or we can even demonstrate of how to use Vithoulkas Compass. You can contact us either on support@vithoulkascompass.com or even myself directly, which is Chokanas, which is my name, at vithoulkascompass.com. Even if you have any quick question you may need to answer very quickly, you can contact us either on mobile or Viber or WhatsApp on this number you see on your screen. And we will try to answer your question immediately or within 24 hours. So if you need something immediately, you may contact us on, as I said, Viber or WhatsApp. That's all from me. I would like to thank all of you for joining this webinar, which is quite important for us to know that you are here for us and we are here for you. So we can do our best to improve this repertoire. This is the Vithoulkas Compass. Thank you again. Thank you, Dr. Atul. Thank you, Lefteris. And thank you, everyone, for joining this and attending this webinar. Thank you.
Thank you. Thank you.
Thank you. Thank you, everyone. Bye-bye.